All right. June 2022. We finished last meeting. We're really talking about culture guide and having culture. We talked about 5 levels of leadership. We were talking about, from John Maxwell, talking about maximizing in interviews and keeping employees. It just kind of became this big fireside chat on culture. But really what we got down to was effective communication. And we talked about having effective meetings. And we said, you know what? We got to keep talking about communication as a function of leadership, as a function of keeping employees. And so let's just kind of pick it up from there. Dr. Goldberg, what do you think?
So I've had 4 out of the past 7 weekends with our mastermind groups of, we have groups of only about 7 to 8 dentists at a time.
Mm-hmm.
And these are all docs who are either specializing in sleep and TMJ, or have sleep and TMJ as a part of their general practices. Now, I've been working with some of these docs for close to 4 years. And after each session, I sort of do a post-mortem and say, okay, well, what's been going on and why is it happening?
Mm-hmm.
And after each session, I just kept on coming back to the issue of leadership, and specifically the issue of communication. And I think that I had a slide, I should give it to you. It's really challenging when the dentist has to play multiple roles.
Yeah.
So, you have the dentist as the technician,
Mm-hmm.
you have the dentist as the manager,
Mm-hmm.
and then you have the
Office
dentist
manager
as the owner.
Yeah.
Right. And, I look back at my career and how I built an operating system around sort of my strengths. And I had an operating system which I called the airline pilot system. So the airline pilot system is when the plane takes off, the cabin doors are shut, no one goes into the cabin. The airline pilot has no idea what's going on in the back.
Yep.
Everyone else is taking care of it. So when I was in the operatory treating a patient, that was how I wanted to be treated. I wanted to be focused on the patient. I didn't want to have the office manager role. I didn't want to have the owner role. I wanted to have dentist role.
Yeah.
Technician.
Yeah.
And that's hard. That's really hard.
Yeah.
And when I get taken out of that, so think about it, every time a dentist is taken out of that treatment room, whether or not it's, someone, knocking on the operatory door or wall and saying, we're ready for an exam.
Yeah.
In the hygiene room, right?
Mm-hmm.
Or something else, it breaks that focus. And for me, that was a problem.
Mm-hmm.
It was a problem for my personality, which is in the disc profile, I'm a D.
Yeah.
Right. So I'm focused totally on results. You rip me away.
Yeah.
And sometimes my reactions may not have been as appropriate as I would have liked.
Okay. I love the transparency.
You know what? And that's what I try to tell people. I built an operating system that around my strengths and weaknesses.
What worked for you? Yeah.
Now, some people are okay with, sort of multitasking while, their ears, open, they hear what's going on in the other treatment rooms, they're poking their head out of the, into the hallway and seeing who's coming in and whatnot, or constantly looking at the schedule. That's not me.
Mm-hmm.
And I don't want to do that. And when I was forced to do that, bad things happened. So I developed the airline pilot, analogy, and everyone knew it. And you have to compensate for that because you do need communication.
How do you
right?
communicate back and forth? Yeah.
Right. So that has to do with scheduling properly. So I knew when I would need to go to a hygiene room. That was on the schedule. Now, no plan survives patient contact. So you never know
what's going to happen. Yeah.
But we had this discussion with our hygienists. So our hygienists did their introduction to a patient. Let's say it was a recare patient. Reviewed the medical history and whatnot. Took a look in the mouth to see what was going on. He asked the patient, obviously. Took appropriate radiographs and photographs. So we were big on intraoral photographs. And then let me know through our intercom system. We used a system called VCOM, which had like a banner across our computer screen. And it showed up so we used 12 o'clock delivery system. So we had a 12 o'clock
behind the patient's head. Yeah.
Behind the patient's head. And then we had in front of the patient monitors.
Yeah.
So the VCOM did not show up on the patient side. It only showed up behind, and it would flash across hygiene, ready for exam. So as soon as they took those x-rays photographs, I was able to go into and do an exam. And I would come in anytime during the hygiene visit. I would not wait till the end, because if I had a break and I was available and I knew this patient needed to have an exam, I did the exam right away.
Yeah. There's got to be a cutoff where it's no longer appropriate for you to go in the hygiene room because it'll just make them way too late. Typically, and I let offices decide when that cutoff is, but typically about 45 minutes into appointment, it's like, okay, doctor's not coming in. This is the cutoff point, because you show up at minute 52, there's no way they're running on time for the next appointment. So you got to time it just right.
So I gave this a lot of thought because we started using telemedicine in March of 2020 with my clients.
Yeah.
Which really saved a lot of them, because in TMJ and in dental sleep medicine, you can do a lot of stuff with telemedicine. Not so much with general dentistry. However, what we did do when we came back in June, if I couldn't go and do a hygiene check, we had x-rays, we had the photographs. I did the hygiene exam via telemedicine. After hours, or whenever I could, I would, so the patient, doctor's in the midst of something, I don't want to keep you waiting. He will get back to you via telemedicine. He'll go over the findings with you.
So you're looking at x-rays and intraoral photos, and then you're having a Zoom meeting with the patient.
And what was nice was in telemedicine, you're able to put up the photographs and show people things.
Yeah.
And just have that discussion. It's actually, I mean, you have to think about it. And I say this all the time. The worst place to have a conversation is in a dental treatment room.
Yeah.
Right? We forget that for most normal human beings, that is one of the scariest places on earth.
They don't want to be there. Yeah. Yeah.
And so what happens when your cortisol level goes up? Your cortisol level goes up, you stop hearing things.
They're not listening to what you're saying.
They're not listening. Right. So if you have to talk, so for instance, we want everybody to screen for sleep disordered breathing, right? All right. American Dental Association, I guess back in 2017, said everybody should be screening for sleep apnea. They don't tell you how, but they say, well, you should.
Yeah.
Fine. We want that to happen. We want all our patients being screened for Invisalign, right? That's not a simple conversation. That is a discussion, because people have lived with their teeth as crooked as they are for a long time. And if they do need something, you have to give them a fairly decent rationale and benefit
As to why.
towards that treatment.
Yeah.
That is a conversation that often doesn't have enough time given to it during the hygiene visit. So this telemedicine is a great way of doing that. And they're at home.
They're more
They're at
relaxed.
home. First of all, you're not masked.
Yeah.
So you're seeing people's faces.
Mm-hmm.
And it's in a comfortable environment where they're actually going to hear you. So again, that kind of communication is important. You know, it's important for the doc and his staff. It's important for the staff and each other, fellow team members, and it's important with the entire practice and the patient.
Well, and that's the doctor playing the technician role and communicating, and sometimes it just doesn't work. It doesn't work for the doctor to come and do the exam. That's unfortunately the least important thing to do at that moment. And to pull away from production or whatever it is, there's just something important going on you just can't get away from. You know, we always have to give our clients, you know, so at All Star, you know, we do exam typing. We've talked about that. You know, we do just different ways, try to create flexibility, remove friction. We want to make it easier for people to do business with you. So understanding disc, and you kind of scratched that surface a little bit, which we could jump into, but you know, teaching clients disc and understanding some patients, you look at their disc and you go, it's really important for doctor to come into this visit. It's super important. And it becomes a lesser of two evils sometimes, and say, okay, what am I giving up to go get, you know, running on time and providing great care and being in two places at once? But you got to communicate about that. And that starts at your morning huddle. And then it continues on through whatever technical devices you're using throughout the day to make sure you're on the same page.
So that's fascinating to me. So you're saying that you're asking your practices to understand the patient's disc.
Mm-hmm.
How do you do that?
Yeah. So we use first we got to teach the team what disc is, right? So the team's got to understand disc. And then from there, they have to understand how to identify the patient's disc profile. So on the screen, I'll share my screen here real quick, just since we're talking about communication, this works. Share screen. So this is the disc format I use, and I teach them what DISC is. So dominant, this would be like Simon Cowell, you know, way up here extreme, you know, down here in the middle be your average D, you know, and then influencing, this would be like Tigger or Will Ferrell way out here, and your average I is somewhere in the middle. This is 0. And they take a profile. S, you know, you got your Tom Hanks, Meg Ryan's, you know, Sandra Bullock's way out here, and your average S in here. And then C would be like, I don't know, Bill Gates or somebody way out here, very extreme into the science and structure, or Elon Musk or something like that. And so what I do is actually the words on the outside are what's important. So if you were to take a Simon Cowell and say, well, is he a teller, extroverted, or is he asking introvert? Oh, he's definitely a teller. Okay. And is he people friendly, or is he task driven? He's on to the next person. And so he is a D personality type. And so we teach them how to identify their patient's disc. We teach them 3 levels. So I'm an I'm a disc certified trainer, and I've been teaching it even before All Star. I mean, we love it at All Star. Larry Gazzardo is All Star. He's disc certified as well. So we love disc. We use it with all of them. But the point is, use it with your team, know how to communicate as a team together with disc, but also know how to use it with your patients. Know how to say, okay, if I've got a D, when I'm sharing information with Dr. Goldberg, I got to give him the bottom line. We got to be moving and grooving. So from a team standpoint, when you're the pilot up there, it's just boom, boom, boom. Here's what's going on, doctor. Here's what's needed. What do you want to do? Here, I have 2 suggestions for you. This or this, you know, give it to you straight, bottom line. But ultimately, the D wants to maintain control. Their fear is manipulation. And so I got to give them that sense of control. So now with a patient, I'm giving them 2 choices: a bad choice, lose your tooth; a good choice, save your tooth. And they have that sense of control when they go through it. And then so on. So I's, you know, it's recognition. S's, it's harmony. C's, it's accuracy. So if you know how to talk to each person on your team in that regard, when you approach them, you adapt to their style. We teach, obviously we all know the golden rule, but we teach the platinum rule on top of that. Treat people the way they want to be treated. So when you got a patient in your chair and they're an S patient, talk about harmony, avoiding conflict, how to make sure they avoid a toothache. And that's how the conversation goes. And it just works so much better for them. With a C, you give them all the details and the accuracies and the research behind it and how many of this and the studies and all that. So we teach offices how to say, okay, DISC with team, got it. Communication, how do you communicate? How do you adapt? But now DISC with patients, how do you communicate with your patients differently based upon the patient's DISC that you've identified? So yeah,
I love that.
so good.
I think that's spectacular, because I've been using DISC since 2006, I guess. So
Yeah.
I never went through the certification, but
Yeah. If you know it,
I've looked at thousands. So I actually included it in one of my books.
Yeah.
So we collated all the data that we got from dentists and dental staff. And I think it was, so what was interesting to me is that dentistry selects for a certain DISC profile.
CD.
No.
What was it?
SC.
Okay. It's got to have some C in there because that's the analytical
definite
research.
C.
Yeah.
Right. Definite C. I mean, you got to have the tight contacts and the closed margins, and and everybody wants a formula. So C's want formulas for everything.
Yes.
Right. So so the typical dentist is a CS or an SC. You don't find that many Ds. And interestingly enough, even amongst dental staff, you don't find that many Is. So the highest I category within the dental office is usually the hygienist.
Yeah.
And that was fascinating to me, because I would have thought that the ideal, so if I would give it, if I was to say to you, what's the ideal DISC for somebody who's at the front desk greeting people and answering the phone?
An IS or SI.
Exactly.
People oriented.
Exactly.
Yeah.
And that's usually not the case.
Yeah. I just did that. The reason I have it pulled up on my screen, I just did this with a team. 55% of the population is S. So they have 4 team members and a doctor. 3 of the team members were SC personality types, and they're so quiet through the team meetings, so quiet, whereas, and the doctor was a C with a backup S, very analytical. And then 1 team member, 1 admin was ID, even on the ID personality type. And so I was going through and saying, look, 15% of the population in D, 15% of the population in I, and 15% of the population in C. 55% of the population's in S. Thank goodness, because they want harmony. This is why we're not World War III. So we have to understand that when patients come to us, we have to get out of our comfort zone to make them feel comfortable. It's not about us. It's about the patient. And DISC is just this system that helps us recognize what it is. Now I go from DISC, that's scratching the surface. That's just it's a very simple way to understand it. It's not too complex. You can use it. And then I go into Strength Finder, which I keep right here. So my Strength Finder book. So once we go from DISC to Strength Finder, you go, oh, wow, I have an Excel grid that takes DISC and all the strengths, and it lays it out and it shows you, oh my gosh, they give you 5. Like my 5 were communication, belief, woo, activator, maximizer. They're all ID personality types. And it just shows you how it overlaps. It's just going deeper into DISC, really.
So are you an ID?
So
I would have said you were an IS.
I'm actually an IC. Huh. But I've had to work on that. Like because of the analytics, the KPIs, the studies that I'm doing and understanding numbers with doctors, I've had to just develop my C so much organically out of the womb. By age 5, you're done. Your personality. I was off the chart. Will Ferrell, Jim Carrey, Joker, comedian. That was me, class clown. as I've gotten professional, and I get in the professional world, the ID started to take over. I got to make decisions. I got to do this. And then once it's relational with clients, the IC is where I go back and forth to. But ID is probably my natural state.
So I have to tell you a funny story. So back in I guess it was either the late 80s or early 90s, Colgate ran a contest for America's Funniest Dentist.
Yeah.
And I was really, really seriously considering doing it because I wanted stand-up comic with something. I was the class clown.
Yeah.
I was friendly with everybody.
Yeah.
You know, and I decided not to enter because I said, you know what? God forbid I win. I don't want to really be known as the funniest dentist in America.
That's probably not going to build the
I want to be known as the best. Not maybe necessarily the funniest.
Yeah.
But I was an I. And when I first took my disc, I was an I. But I had to, when they put me in charge of the faculty practice at Columbia, I had 27 doctor prima donnas, heads of departments and stuff. And I had to really lean into my D. And then when I left academia and I built a group practice with 2 other guys, I also had to lean into my D. So when I take a disc right now, I'm full-fledged on D.
Wow.
Now I'm not all the way out at the outer circle, but I'm a pretty strong D.
You're not Simon Cowell, huh? So here's
I'm not in some regards, but in some regards I am, because I mean, the other thing is now at my stage of life, I just don't care. What other people think, whatnot. I mean, and I'm totally into results. Right. For me, it's all about results.
Sure. So here's the acronym I use. I have it on my phone here. And I'll in a Christian setting, I'll use shapes, but in a secular setting, I'll use shaped. SHAPED. So S, Strength Finder. H, habits. So I use Atomic Habits by James Clear.
Know it.
Yeah. A, accountability. So that's with coaching, is accountability. P, personality profile, which would be DISC. And then E, emotional intelligence.
EQ.
Yep. And then S, spiritual gifting. So just shape. So the next level becomes emotional intelligence. So
what's the D in the secular?
DISC. DISC, which is personality profile. Same thing. So how are you shaped? Right? How are you shaped is how each of us are wired. And so we're talking about leadership, we're talking about communication, right? So you look at this, and I don't necessarily do it in this order, Strength Finder, habits, but I usually start with personality profile, okay, which is DISC. And then I go Strength Finder, and then I go emotional intelligence, figure out which of the 4, someone's weak in, and then work on that. And then we go into accountability of those things to start developing habits. And this is a very, very simple outline acronym for each individual getting better so that the whole team is getting better. We're getting healthier.
So I'm curious, why in a secular setting do you drop the spiritual?
Well, some people don't want to take a spiritual inventory and find out, it's a spiritual gifts assessment. So in my Christian setting, whether I'm doing like life coaching or whatever, I give them the option. Do you want to do a spiritual gifts assessment? And some people just don't know what that means. Are you apostolic? Are you pastoral? What is it that you have? Now, when it comes to team building, you can use the 5 love languages by Gary Chapman. And you take this to team and we change it to appreciation. So, gifts, touch, words of encouragement, acts of service, and quality time. You realize the people I work with don't feel appreciated because I keep giving them a bonus every month, and they're not gifts. their words of encouragement. Oh, I need to figure out how to communicate with them. Just like this, I need to adapt to their style and work with them. So all of these things are so intertwined and require a compass on each of them, but also somebody who's checking the dials. You talked about the airline, the pilot thing. It's like, you got to be reading all the dials. If you're not paying attention to what's going on back there, maybe the oxygen's gone, they're all passed out. They're not even paying attention. You're just going. And, you got to keep them inspired. You got to be the captain. That's who they respect the most. And that takes communication.
So, so the other part of the post-mortem of looking back at these 4 sessions was that very few offices have a really competent manager.
Mm-hmm.
And, I always look, this is my dental training, but it went even before that. I always want to know why things happen. So, you think about how a dental practice evolves. It usually starts with, either someone bought an existing practice, or in, days gone by, people would start their own practices.
Yep.
And you start a practice, it's small, it's a doc and, maybe an assistant, maybe one person at the front desk.
Yep.
And a hygienist. And then as it grows, you need more people at the front desk, and then you need more clinical people, and it starts growing. Look at where most office managers come from. Oftentimes, it's a dental assistant who might not have wanted to go back to school to become a hygienist in order to make more money, but they decided to go to the front desk, and then or maybe it was a hygienist who no longer wanted to deal with their hands.
The feelings of their hands. Yeah.
Few of these people have the training, the skill sets that a true office manager probably needs to have, or that the dentist needs that person to have in order to have the trust and confidence that they're going to do what they would wind up doing as, when they were in the managerial role. So that's why it when they're in the technician role, if they don't trust that what's happening in the rest of the office is going right, it's a real problem. And that's mistakes happen, right? That when the doctor loses focus on what's going on, bad things happen, not just with the team, but with patient care as well.
Your company, your business. Dentists, I call them, they're absentee owners, not like in the sense that we would know that as an absentee owner, but in the fact that they're a worker, they're on the work line, they're an owner who's on the assembly line working. They can't see, well, how's our marketing doing? What's our budget look like? They're in the mouth doing the work.
And I think that is what feeds the DSO frenzy. So it's the dentists who don't have the ability to, compartmentalize their day, so that in fact they can focus on patient care and then set aside some additional time to focus on the business. They think that by selling a practice to a DSO, they lose that.
You still got to be a leader.
You still have, exactly. You still, it's not as if someone from the DSO is going to be watching what's going on every day. It's not as if, so someone said, you know what, I'm tired of dealing with this employee, issue, all the employee issues. I don't want to start looking for employees anymore. I'm going to sell it. I'm going to let the DSO handle it. Right. But you still have to work with when someone calls in sick, or when you when you have an open position that's not filled. You still have to deal with the fallout.
There's strength in numbers. Just don't get mixed up and think it's this romanticized by the thought that somebody else is going to do your job. You're still, you don't realize this, but you went to dental school to become a dentist. You didn't realize you went to dental school to become a leader, and you're a business owner. And that's the hard part. And that's, everything falls on your shoulders. Now you can diversify as much as you want, but it doesn't eliminate the risk that you as the business owner assume all the risk. So understanding how all of these different communication styles and accountabilities and communications, appreciations and personalities and strength finder and emotional intelligence, they all play a role in how you lead your team. At the end of the day, John Maxwell says, leadership is nothing more than influence. That's all it is. It's how you influence people. And you can't influence them if you don't know what their disc is, what their strengths are, how they like to be appreciated, what their emotional intelligence is, what are their habits, how do you improve their habits, how do you create accountability in that? And I mean, at All Star, it's all we focus on. We do doctor one-on-one coaching. It's typically, what's going on with your team? We're looking at numbers. We're looking at, team meeting. What are we going to cover? How do we improve? How training? But at the end of the day, it's how are you doing with your team? What's going on there? And we're in the middle of the Great Resignation. And
so do you find that dentists, doctor owners oftentimes even know what's going on with their team?
I think they think, well, okay, let me say that my clients that I work with do, because we've worked on how to be in tune and check in. You've got to be checking in. You've got to have that 15 to 30 minutes a month that you meet with every single team member one-on-one. If you're not doing that, you don't know what's going on with them. And then there's this fine line between respect as the owner and being too friendly with them as an individual and overdoing the relationship side. But you have to have a relationship side. So if you're a dentist owner and you don't know anything about their family, you don't know where they went on their last vacation, you don't know, about their kids, what's going on in their life, you're not being an owner. You're not being in a relationship. Some people think, oh, no, they need to just respect me. I'm going to be back here in the office and I'll just fire someone every now and again. That doesn't work in them being influenced by you. You cannot influence them without that. So
I'm gonna ask you a politically incorrect question because that's me.
Okay.
You find there's cultural issues surrounding that?
I have a lot of Indian clients, a lot of female Indian clients, and they so desperately want to know how to run their business. And so I spend a lot of time on this with them. And I don't know what their grade would be before they come into me. I just know that we're working on it. They stand out to me as somebody that wants to do that. They stand out to me that wants to do that. They don't stand out to me like somebody that just wants to work on teeth. They want a team. They so desperately want a team working with them.
So it's very interesting. So I started teaching in the late 70s, and the demographics of our class changed considerably in the mid 90s.
Mm-hmm.
So that by the end of the mid 90s, towards the end of the 90s, we were probably 3/4 Asian.
Oh, okay.
Whether or not it was Indian or Chinese.
Yep.
And all of a sudden I found my teaching and instructing to be less effective. And I had an English professor as a patient, Columbia. Mm-hmm. And I said one day I would talk and I said, I'm having a problem with my students. They don't seem to be listening to me like they used to. Mm-hmm. I would point stuff out and they'd make mistakes. I'm like, she looks at me and she says, don't you know what's going on? I said, no, if I knew what was going on, I would fix it. She says, well, let me explain what's going on. Culturally, there's a thing about saving face.
Yeah.
And now this is much more in the male than in the female, culturally. Mm-hmm. But asking a question,
if you don't understand,
means that they will think that you will think less of them because they don't know.
Yeah.
There's an embarrassment of not knowing. And I said, okay, you know what? Thank you. And I'm going to now change the rules. So I would have in my introduction to the course, I would say the worst thing that you could do is make a mistake because you didn't ask me a question beforehand. I will think less of you then. I will never think less of you for asking a question.
Yeah.
That's what you're here for. You're here because you don't know.
Who's learning more?
Right.
The person who's asking the questions.
Right.
Well, in fact, that's the C personality issue is the number one thing the C wants is accuracy.
Right.
Their biggest fear is to make a mistake and be criticized for that mistake. So they get stuck in analysis paralysis where they're just overanalyzing and going. And so culturally, whatever it is, doesn't matter. But C, personality wise, it's like get stuck in the details and the minutia going, I've got to get this right. And maybe that's more emphasized in different cultures. I'm not sure, but man, I can totally see where anybody with a high C personality type would operate in that same fashion. I'm not going to ask any questions. I'm just going to let this slide and let it go. Yeah.
So it changed my entire teaching paradigm, and for the better, I hope.
Yeah. That question where when you teach something and then you say, and this could be doctors to patients, doctors to employees, doesn't matter. Employees to patients, doesn't matter. But if you say to someone, do you have any questions for me? Most people don't want to admit they have questions. They look stupid.
And you know what? And that's the reason I hear docs all the time saying, but I told her how to do that.
And she didn't have any questions for me.
Yeah.
Yeah.
But and I have to keep on doing it again.
Yeah.
And it's like,
and that creates inefficiency because they don't know how to do it.
And it makes docs think that their staff is stupid. I mean,
Yeah.
Nothing that we do is rocket science.
Yeah.
I mean, some of the things are challenging, but it's not that challenging. You can train people to do dental assisting. You can train people to answer the phone properly, but they have to be trained. That's the other thing. You have to spend the time.
Yeah.
People don't spend the time, especially now when, people are having open positions in their offices and they want to fill that hole as quickly as possible. The time that you take, that somebody takes. Now, you and I sometimes provide some of that training. But some people don't avail themselves of it. I mean,
yeah.
I'm sure you found that.
Yeah. So some things that you're getting me thinking about that I typed out. Training is communication when it's effective, and people don't take the time to do the training. And it reminded me of this John Maxwell quote that I posted on my social media. It says, the difference between average people and achieving people is their perception of and response to failure. So did you evaluate it? So in my post, I listed out 3 things. So how are you responding to failure, right? How do you respond to failure? How do you evaluate and respond? And so I did 3 things that you have to, that are key. And look, we're all going to make mistakes. So in your training and how you communicate about it. So it's like, don't say, do you have any questions for me? All right, go do it. No, it's, you have to recognize that your team member is going to make mistakes, and you have to empower them to say, I know you're making mistakes because you're trying something new. You're looking to grow. How we celebrate those mistakes will make the difference. So number 1, acknowledge the mistake. Number 2, evaluate it and improve. And number 3, celebrate the mistake by sharing your new way of doing things with others. So when you can actually figure out as an employee or as an owner, how to empower your employees to, it's okay to make mistakes. Without mistakes, we're not growing. That's the simple truth. So don't be frustrated that mistakes are being made. Be frustrated that you're not helping them to celebrate and acknowledge those mistakes and bring it forth to everybody. Hey, I made a big mistake yesterday. I don't know if everybody knows this or not. Maybe I was the only one, but here's what I did. I didn't collect the money up front. They walked out and they didn't pay, whatever it is, right? And then you have to move through it together.
So I've been doing a lot of phone stuff lately with clients.
Yeah.
And, I review the recordings.
Mm-hmm. Yeah.
And invariably, if I'm going to critique it to the doctor, the subject line of the email on the critique is great news.
We've got work to do.
No. Yeah. But there's potential. I said, the best thing you could have me do is find problems.
Yeah.
Because then you can improve.
Yeah. Yeah. So
I mean, if you're doing everything right, you're still not getting great results.
It's the definition of insanity, right? Doing the same thing over and over again, expecting a different result. It takes change. It takes effort. It takes to be on purpose. So the funny thing is, here's my post right before that. Rejection. in life or in business. It's a painful thing, but not as painful as complacency, being lethargic, lonely, or living in fear, or expecting a different result, right? Definition of insanity. Don't let the fear of rejection force you to fall into approval addiction. Keep searching passionately, keep putting yourself out there, because your drive and determination will eventually prevail. And what would you regret more? Having never tried and therefore nothing to show for it, right? You just live in this fear, or having tried until you prevailed and showing up at the finish line with a few scars. And I think that's the point, is we're so afraid. We have so much, you called it saving face, right? We have so much approval addiction. We have so much fear of what judgment. We become this judgmental society with social media that we retreat into mediocrity. We just go, I'm just going to relax back here, instead of saying, I'm going to run through the punching bags right now. I'm going to run through them. And then I'm going to look back at the punching bags and I'm going to say, where could I have, dodge, dive, dip, duck, and dodge, to quote a movie. And you got to know how to navigate, so the next time you run through, you do it better, or you could show someone else how to get through. You could be a leader. And an ownership mentality is really what we're talking about. You can't just be someone who closes the door in the cockpit and says, good luck. You got to be somebody that communicates before you go in there, morning huddle. You got to be somebody who's evaluating after the flight. You got to go through the pre-checklist, the post-checklist. You got to get the next pilot ready. You've got patients walking in on the plane. You've got to greet them when they come in, thank you when they leave. You've got to have it all. It's such a great analogy. And the plane's not taking off, and it's definitely not hitting high altitudes without happy people. You got to have enough people in the seats. You got to have butts in the seats to say, yes, I want you to fly me. Yeah.
So I love the airport analogy, because it also requires a control tower with somebody making sure that everything that's going on in those treatment rooms is synchronized, and things don't crash into one another. So so I actually like the analogy of the sort of air traffic controller as the office manager.
Yeah, the admin team. Yeah, for sure. Yeah, making sure things are coordinated, whether it's team coordination or patient coordination. It really boils down to communication. Like you said, it's such a key. And I'll say this, effective communication, because you could be communicating and not be effective and go, well, I'm communicating. Disc.
Who had that quote? It's the biggest problem is the let me see that. I think I actually have it here. Is the appearance of communication. I mean, just because you said it doesn't necessarily mean they've heard it.
That's
the whole point. That's the example of telemedicine and patient presentations, because it's in a less fearful environment. You're looking at a person without a mask. So it's more genuine. There's a lot of advantage to it. It's one of those things that we adopted because we had to, because of the pandemic. And it's one of those things that more and more of my clients are leaning into, as well as the value of being able to do things remotely.
Comfortable.
When you start, I mean, out by you, that's what, over $6 a gallon of gas, right?
Yeah. Why are you doing that to me right now? Yes, it's expensive.
Sorry.
Yeah, no, it is.
But think about your patients who used to drive without thinking twice.
Yeah.
Now, every mile I drive, it's costing me money.
Stay at home.
And if you can offer things at home, and think about that with your employees as well. I mean, what roles in the office can be done remotely that do not require a face-to-face interaction with a patient? I have a client whose phones, they're in St. Louis, phones are being answered in Dallas.
Yeah. I'm just to say, I was just going to tell you, the first time I've got 3 offices where they have a remote admin team member, not the whole admin, but they have a remote admin team, and they just didn't come back and they want to stay on the team, but they're going to work from home, and it's working out as long as you have the right clarity of procedures and and expectations, I think it can work. And I really think what we're talking about here is how to remove friction. We talked about this a long time ago, but removing friction. How do you make it easier for people to do business with you? Patient, let's do it via Zoom. Why does it always have to be this form? It can take a lot of forms and still be effective. You just got to understand, am I being flexible with it? So, all right, we did good today. I'm gonna end the recording. You and your recording you're in. We'll post this. Everybody will share it, and hopefully everybody's getting a lot out of it here.
Yeah.
Thanks
Okay.
for joining us, guys.
Thank you.
All right, stop.